Greetings. I'm Ron Epstein, and I'm really pleased to be with you here today. I'm going to share my screen, and I'll be talking with you about mindfulness and how uh, mindfulness can enhance the care we provide to others and also to ourselves. The required disclosure slide, I don't have any financial conflicts of interest. And what I'd like to start with is just context. Okay, so for the past year and a half, this is my house. I've been working from home, as many of you have been at least part of the time, when I'm not on service in the hospital on the palliative care service. And if you were to walk up this brick walkway and take the left turn, and you'll see a couple of blue flower pots on the steps going up to the deck. And if you went a little beyond that, you can barely see on the left-hand side of your screen a glass door. And right now, if you looked into that glass door, you would see me. That's where my office is. But the other part of the context that I'm working with is this. And one of the interesting things about these photographs is that although many of us have been in the position of the person standing by the side of the bed, many of our colleagues and friends and loved ones have also been the people in the bed. And so the risk, the sense of vulnerability that we're all feeling really is enhanced by that realization that we too might be affected by the pandemic in multiple ways. About 2 months before the pandemic started, my first grandchild was born. She lives with her parents, my son and his wife, in Los Angeles. And so all of us have been experiencing some form of isolation or separation. And this has been distressing. And not only us as clinicians, but also the families that we care for. During the lockdown periods, visitors haven't been allowed or have been severely restricted. And you all know what that reality has been like. Now, this is a conference on neuropalliative care, and it's rather timely, given that in my own family, I'm living a lot of the principles that we're talking about these few days together. This is a photograph of my mother in the New York Botanical Garden in the Bronx. And my mother's 88 and was a practicing psychotherapist until a couple of years ago when she had to stop due to advancing dementia. She's been very fortunate in that her dementia has been a happy one. She can't remember very much, but she kind of jokes about it and has always said, well, at least my body is healthy. Well, that all changed in April when she was diagnosed with stage 4 lung cancer with pericardial and pleural metastases and effusions in both areas. And strikingly, this is a photograph that I took only 2 or 3 weeks ago. This is nearly 6 months into her diagnosis. And she still feels and looks robust, even though she can only walk a few feet at this point and is losing weight rather rapidly. So this is a daily reality for me, is how do we help her with the capacities that she does have to make decisions on her own behalf based on the values that she's lived for her entire life, even though she can't remember anything for more than 5 minutes. We've also been dealing with tremendous uncertainty, and I want to talk a little bit about the flavors of uncertainty. And for that, I'm really indebted to Paul Hahn, who's at the National Cancer Institute, who's written really eloquently about what uncertainty is and how we manage it. The kind of uncertainty that we learn about in medical training is generally aleatory, or what's called stochastic uncertainty, which is just really a question of statistical assignment. That is, we know that a particular treatment works for 70% of people and doesn't work for 30%. And the question is whether this particular patient falls into the 70 or 30. And sometimes we can assign or try to narrow down that uncertainty by taking into account demographic factors, et cetera. But it's really, it's the known unknown. Now, with the current pandemic and with other situations that we typically encounter, we're often in this realm of the unknown, otherwise known as epistemic uncertainty. And this is really characterized by complexity, multifactorial causation, and also just an absence of data or conflicting data. And it's really hard to navigate our way through that. We have a friend who's coming over for dinner tonight. So do we eat out on the porch or do we have her come inside? How do we actually assess that? We're all vaccinated. She teaches. Some of the people she teaches might be exposed. We just don't know. And that's just a minor example of the multiple epistemic uncertainties that we've been dealing with. So I've been reading a lot about terror management theory over the past couple of years, and this is something that was proposed in the 1970s and elaborated further in the 1980s and 90s. And basically, it talks about how humans tend to act when they're confronted with their own mortality. Now, we all know we're going to die, but sometimes that really comes a little bit close and sometimes too close for comfort. And many of us have probably had health scares or serious illnesses. And it's just that gut-wrenching feeling that everything that we've taken for granted may not continue to exist. So mortality salience or other serious existential threats. And the theory is simple. It says that in those circumstances, we try to do things that bolster our self-esteem, our sense of value in the world, our sense of adherence to our own principles. And so this kind of goes through three phases. At first, we engage in denial. I think we all did that early in the pandemic. We tend to minimize, deny, saying that it's not going to happen to me, I'm taking enough care, et cetera. And often in the process, engage in sometimes seemingly irrational actions. For example, I noticed that at the beginning of the pandemic, in our house, we don't lock the doors during the daytime. Most of our neighbors don't. But when the pandemic started, I realized I was actually turning the lock. As if locking the door would keep the virus away. I mean, it was that's the only way I can put it together, but it's something that I hadn't done previously. When that begins to dissipate, when the immediate threat and denial begin to dissipate, and for each of us that takes a different amount of time, then we begin to try to seek affiliation, especially with those who share our values, beliefs, and aspirations. And this can be a really positive thing. It's a form of social support. And we also seek symbolic immortality, to be able to do things that will outlive us. So sometimes that is greater connection to family, especially family who are younger than we are, like my granddaughter. And sometimes it's adherence to a cause, donations, et cetera. But terror management has a downside. By reinforcing belief systems, it tends to close you off to disconfirming data and contrasting belief systems. And I think we've seen this to some degree globally, but especially in this country during the pandemic. Greater conformity to group expectations and less questioning of one's own values and the values of the group to which one pertains. Tribalism. So this kind of closing down is what the developers of terror management theory call worldview defense. It's trying to act as if our worldview is the only one, and we more assiduously try to define and defend it. So I'm going to pivot a little bit and make a proposal, okay? Just let's engage in a little exercise here. And what I'd like you to do is imagine that it's 2 years from now, and you realize that you've navigated the current crisis to the best of your abilities in such a way that you were able to be attentive, energetic, creative, resourceful, robust. You can add whatever adjectives you'd like to that. Consider a few words that would describe your quality of mind when you're working at your best. And then what is it about who you are your skills, your beliefs, your qualities, your virtues. What is it about you as a person uh, that enable you to be at your best? What kind of person are you? And what qualities will you have had to learn in order to better navigate this? So again, you're thinking now it's 2023, you're looking back at 2021, and just reflecting on what helped you get through this time in as creative a way as possible. So part of why I'm raising this question is that a lot of those qualities are the things that comprise mindfulness. Now, Rollo May was a psychologist who wrote in the 50s, 60s, and 70s. And he talked a lot about human freedom and was really talking about the freedom of unconstrained by uh, by our own tendency to react and not respond mindfully. So he talked about this capacity to pause between stimulus and response, just finding these times during the day when something comes in, we have this tendency or this predilection to have a knee-jerk reaction, and we recognize that soon enough so that we can just pause and choose the one response toward which we wish to throw our weight. And this is part of being self-aware, but it's allowing for opening up at a time when we would normally close down. And especially in situations that invoke dissonance, fear, doubt, uncertainty, it's particularly difficult to do that. And so this cultivated ability of mindfulness is to be aware of this flow of thoughts and feelings and bodily sensations in such a way that they're helpful to us in everyday life. So the first aspect of mindfulness has to do with attention and regulation of attention. Now, this quote from Anais Nin, we don't see things as they are, we see things as we are. Many other people have said in other ways, but it's really true. We tend to focus our gaze on things that reinforce our worldview. There's a psychologist named Lisa Feldman Barrett who's written a couple of books recently. One, a more popular book is called 7.5 Lessons About the Brain or something like that, and one more scholarly book. And she's a neuroscience researcher. And her thesis is that the brain is largely a predictive organ. That is, we're trying to predict what is going to happen next so that we can better ensure our survival. And when we're doing that prediction, that actually hones what we pay attention to. So all the stimuli that are coming in through our olfactory and visual and acoustic senses are impossible to assimilate all at once. So we're constantly making conscious or unconscious choices about what to attend to. And we'd like to always think that we attend to those things that matter the most, but we know otherwise, that distractions of a variety of natures tend to hijack our awareness. And often we find ourselves deviating from those things that, if we were to reflect more deeply, might be the most important things to pay attention to. So one example, I do communication research and I've listened to thousands of audio recordings of visits between patients and doctors. Now, if a patient is visiting an oncologist or a surgeon or, I don't know, perhaps a neurologist, I don't know, and they present a physical symptom, the physician is most likely to respond like 80% or 90% of the time to that symptom, and in such a way as to clarify it or try to evaluate it. If a patient mentions a psychological symptom or experience, fear, anxiety, distress of some sort, depending upon the specialty, we tend to ignore that, even among psychiatrists, surprisingly. There still is a predilection for somatic symptoms. And so why is that the case? Maybe we feel that that's something we can do more about, or our training guides our attention towards that. But just think about it for a moment. Patients often come to us because they're afraid of something, and all they're wanting is some kind of validation that their fears are justified. So it may not reflect what patients actually want from us. The first aspect of mindfulness is the regulation of attention. The second is curiosity and the cultivation of a kind of critical curiosity in the face of dissonance and doubt and threat and loss. And this is particularly important because these are the circumstances in which we're most likely to close down. We're most likely not to say, is there another way I could see this situation? Or what's really interesting about this patient? There's a great article about curiosity by Faith Fitzgerald, written about, I think it was also written in 1999. And she talks about on rounds, she's an internist in Sacramento, California, and she talks about on rounds, on morning report, she'll ask residents to report on the most boring case that was admitted overnight. And she just takes this as a personal exercise to try to find something interesting, something that captures her attention and her curiosity in every patient. And I think it's probably a useful thing for all of us. What's interesting and unique about this situation as opposed to others that might appear similar? So the idea of beginner's mind comes out of Zen Buddhism, and there's a Zen story about beginner's mind. Two monks were watching a flag flapping in the wind. One said to the other, "The flag is moving." Now, this being a Zen story, 3 hours elapse. And then the other monk replies, "The wind is moving." A period of time elapses, and Weneng, their teacher, overheard this. He said, "Not the flag, not the wind, mind is moving." So let me give you a visual example here. This was a photograph taken during Superstorm Sandy on a beach, I think it was in North Carolina. And if you imagine yourself standing on this beach and looking slightly to the left, and you see this pier, and just let feelings come to mind about this scene. You know, is it peaceful? Is it turbulent? Is it, most people would say it's some degree of fear or distress or danger. And now take a look at this photograph taken on the same beach during the same storm. And let's presume that you've done a careful mental status exam on this young surfer and found that he is neither psychotic nor suicidal. And notice he does have the surfboard tethered to his leg there, a modicum of safety. And so he may be seeing these rough waters as a source of fun, of excitement. He might get banged up a little bit, but it might make him a better surfer in the process. So, and I think we all, in some way or another, sometimes crave an adrenaline rush, and this kind of seems like a pretty big one. So think about showing up for work on Monday morning, and does work look more like this? Or does work look more like this? So both of these images are true. This is both dangerous and fun. It is both exciting and terrifying. And so we have a choice about how to parse our attention, how to look at this scene. And in fact, if you're going to take a beginner's mind, you'll say this scene is both of those. It encompasses both of those. So it's a both and approach. So we have regulation of attention, critical curiosity, beginner's mind, and the fourth component of mindfulness as it relates to the work that we do as clinicians is presence. And you know when someone is present with you and when they're just kind of going through the motions, okay? And you can really tell that. My wife is a musician, and she talks about in concerts that there are some musicians who are really there and some who are just phoning it in. And patients know when you're phoning it in. So this painting is by Goya, painted in 1819 after he recovered from a serious illness. And the inscription at the bottom says, Goya, in gratitude to his friend Arrieta, his Dr. Arrieta, for the skill and great care with which he saved his life in his acute and dangerous illness suffered at the end of 1819. We don't exactly know what the illness is, but just take a look at this scene. It really connotes tremendous intimacy. He's literally supporting the patient. He's giving the patient some kind of potion. God only knows whether that actually contributed to his recovery or not, but it's this sense of being with, of accompanying, of supporting. And I think this image is very powerful and more than words captures this notion of being present. So in the 1990s, after I'd been in practice for about 10 years as a family physician, I began, and I had a large role in medical education, and I began thinking about, well, what constitutes a competent or an excellent physician? What qualities? And clearly there's knowledge and skills and clinical judgment and things, but there also occurred to me that some of the same qualities that musicians try to cultivate in terms of being self-aware while performing, and some of the same qualities that contemplatives try to cultivate of understanding the flow of their own thoughts and feelings and bodily sensations and how those can inform self-awareness, self-knowledge, and action in the world. Some of those same principles could underlie excellence in clinical care. So I wrote an article that was mostly a personal manifesto and sent it off to JAMA without any idea that it would go anywhere. I just thought, well, I need to write this. And luck would have it that it landed on the desk of an editor who really got what I was trying to say. And after a few iterations, it was finally published. And for me, this was a career-changing event because I received lots and lots of correspondence from surgeons, pathologists, psychiatrists, neurologists, family doctors, really every specialty in medicine, that yes, this was really something that was important, that reflected something that was fundamental to their own practice. So this moment-to-moment purposeful attentiveness to one's own interior life during everyday work, not apart from work, but during everyday work, could help us practice with greater clarity, compassion, technical skill, communication. You have it. So, so then the question is, how to cultivate this? And so when people think about mindfulness, they often think about these kinds of beautiful, tranquil settings. And if you visit, retreat centers, they're often in really beautiful, quiet places. But the mindfulness that really matters in the work that we do is this kind of mindfulness. Could you imagine a mindful code? Could you imagine entering an acrimonious family meeting in a mindful way? I mean, I think we all have that capability, but the more acrimonious and conflictual it becomes, and the more personally threatening it becomes, the more difficult it is to be mindful, hence the need for practice. So mindfulness matters. Over the past 20 years, there's been a lot of research on the correlations between this trait attribute that we have called mindfulness and things like stress, burnout, attentiveness, emotional well-being, and also just the actions that we engage in as clinicians. That is, there's less premature closure, therefore more cognitive debiasing and flexibility, greater comfort with uncertainty, nursing units that have more mindful teams have patients who fall less often, fewer needle sticks, fewer medication errors. And patients see that we're able to be more empathic, patient-centered, communicative, relationship and community-oriented. And also by seeing people in more multifaceted ways and opening ourselves up to surprise and uncertainty, there's less implicit bias and less putting people into categories based on demographics. So here's the theory that by being mindful, it can improve the quality of care we provide, the quality of interpersonal care, the quality of caring, empathy, compassion, responsiveness, and also our own well-being. So if mindfulness is so good, if it's something that's helpful for all of us, why aren't we mindful all the time? And if you ask a group of clinicians, these are the things that come up. Now, emotional intensity and unpredictability is part of the nature of our work. It always has been and it always will be. But some of these other things of distractions and interruptions, time pressures, dysfunctional computer systems, the proliferation of meaningless administrative tasks, those are things that organizations can do something about. And so mindfulness is not just an individual responsibility, but also a collective one. This is a painting of Prometheus. If you remember your Greek mythology, Prometheus brought fire to humanity. Zeus didn't like it and had him chained to a rock, and every day was visited by an eagle that would peck at his liver. So I'll ask you, in these days about your clinical life, what pecks at your liver every day? Is it the sense of decreasing control, increasing responsibility, the sense of isolation that a lot of us are feeling? Is it something else on this list, or is it something else entirely? Even things that we value deeply, like empathy, highly present, sensitively attuned, well-boundaried, heartfelt engagement with patients, as Michael Carney describes it. Even empathy can be distressing and can bring us further away from being mindful. This is a self-portrait by Frida Kahlo, the Mexican artist, who suffered a spinal injury when she was young and was in chronic pain for the remainder of her life. And you can see her depiction of her corsets, the radicular distribution of her pain. And in writing about empathy as emotional labor, Erik Larson talked about the willingness to subject one's mind to the patient's world. I can remember when I saw this painting first at an art exhibition in New York, and I had to avert my gaze. It's disturbing. It's bleak. It's about pain. She's looking right at you. And I think the same tendency happens with sometimes with the kinds of distress our patients present us, or sometimes our colleagues. That is, there's this initial tendency to turn away. And so to recognize that and accommodate for it also is part of being mindful. So in thinking about the distress that we experience at work, I tend to think of that as a relationship problem. On the one hand, of our sense of values, calling, meaning, why did you go into medicine in the first place? Why do you keep doing it? And the environment in which you work. So the environment may or may not be supportive, or as for most of us, it's a mix. There are parts of it that are supportive and parts of it that are pretty toxic. Christina Maslach started writing about work-related burnout in the 1970s and originally defined it as an erosion of the soul, deteriorations of value, dignity, spirit, and will. I've looked in the ICD-10 and there's no diagnostic category for erosion of the soul, but I think we all know what that means. It's pretty graphic. So it's not just simply emotional exhaustion and feeling that you're not doing a great job and cynicism, which is the three things that are measured in the burnout scales. But it really goes deeper. It goes to, who am I as a person? And am I able to uphold those things that are most important to me? And we know that clinician distress matters, that in terms of quality of care, patient experience, clinician experience, patient safety, professionalism, and also costs. Burnout is expensive for healthcare systems in terms of attrition and job turnover and recruitment costs. And we also know that many people have tried to do something about clinician well-being. The most common being some kind of mindfulness-based intervention, but these are highly heterogeneous. I'll just talk briefly about one that we are currently doing, our group here in Rochester. We're offering intensive 4-day workshops for clinicians and recently published outcomes of those. And you can see that measuring change 2 months after a workshop, there seems to be an improvement in burnout and well-being, in patient-centered compassionate care, job engagement and satisfaction, positive emotion, and stress-related symptoms. So these things are all changeable, and whether they'll revert back to the mean with the lack of reinforcement from the institution, that's an important question to ask. But at least we can say that there is movement. It's possible to move the needle. The things that didn't change are equally important. Their rating of the supportiveness of the work environment, feeling valued by their organization, their intent to find another job, those things didn't change. And I think those are really in the domain of the work environment itself. And I'm not suggesting that we should try to adapt to toxic work environments. We need to change those while also trying to become self-aware ourselves. So what can healthcare institutions do? Well, they can be proactive by keeping people safe, being flexible, measuring well-being, and sharing the results. Human factors design refers to information technology fitting the way that our brains work, rather than trying to fit our brains into the way that the computer seems to want us to think. Reducing regulatory reducing things that don't matter, but also doing positive things like peer coaching programs, quiet spaces to have your lunch and not actually be outside the din of the hospital noise, or even just to go and reflect and be quiet. At our institution, we have a variety of forums for reflection and self-awareness. Other institutions have other ones. Regardless, this is just not enough. They're compared to the efforts taken in other industries. I think that we don't, in healthcare, pay attention to the well-being of our own workforce. And then there are these reactive, debriefing after traumatic events, peer support. In some departments now, we have trained peer coaches that you can call up if you experience something traumatic, an unexpected death, et cetera. And they'll help talk you through it and provide resources. Also, creating an environment that's free of abuse and harassment and incivility and discrimination, how you can report adverse effects that you're not feeling blamed for, and also non-stigmatizing access to counseling and support. So what can you do? And I'm just going to make a few suggestions here. First, in terms of principles, engage rather than withdrawing. So you're just back from a very well-deserved vacation. You spent a week on the beach. You had a great time with your family. You're well-rested, well-fed, and you come back to work, and work is exactly the same as it was when you left. Surprise, surprise. So the sustainability question is really depends upon changing that relationship that you have to your workplace, which sometimes involves changing the workplace. Resilience, we know, is not a given. It's something that can be grown throughout the lifespan, but also requires some degree of nurturance. So think about your role as a leader in your organization or your clinical team, or even as a supervisor for a person more junior to you. And what can you do in that environment to help your team, your mentee, your organization be more nurturing of mindfulness and self-awareness? And also, mindfulness is not a solitary activity. It's a community activity. It's a group effort. And we can really talk about team mindfulness or organizational mindfulness. In fact, at business schools, that is something that people look at. There's a guy named Carl Weick. I think he's at, I'm not mistaken, at Case, but who writes about institutional mindfulness. So the foundation of mindfulness is awareness. And the first foundation of awareness is in your body. And why is that the case? Because I just like to think of it, bodies are less likely to deceive us than the mind. And so the earliest warning signs of stress often are felt in your body as maybe your breathing quickens, your heart rate quickens, a tremor, various other things, muscle tension, shoulders, what have you. So just ask yourself questions. What do you feel in your body at the earliest warning sign of stress, when your stress is a millimeter above baseline? What emotions accompany those signs of stress? What thoughts? Okay. And if we were in a workshop, we would try to, flesh this out a little bit and say, well, then now that you know that it's shoulder tension, that's your first warning sign, how are you going to be aware of that? Are you going to put a little reminder on your below your computer monitor? How are you going to remind yourself to use that as a barometer for your stress level? Because we know that if you've got a little bit of stress, most of us can manage that pretty easily. If you've got a real lot of stress, that starts becoming more difficult. The word mindfulness comes from words in Sanskrit and Pali that literally mean remembering. And I like to think of that here. What is it that you need to remember every day to keep yourself aligned with what's most important? And how are you going to prompt yourself? These are really pragmatic issues. And sometimes even these kind of distracting devices can be helpful. I actually set my alarm for a particular time 3 times a week just to remind me to pay attention to what my body is telling me. This takes 0 time. Okay, you don't have to go off to a retreat center to do this. The second is to be aware of your values, and I think most of us are. And most of us are aware of the positive aspects of those values, but tend to be a little bit blind to the dark side of them. So take the issue of valuing competence. Well, if it gets out of hand, we either feel omnipotent or feel like an imposter. And so the healthy mean there is knowing one's limitations. Knowledge can translate as to comfort with uncertainty and knowing what's unknown, but also can translate as an obsessive need to be certain about everything, which of course in medicine is impossible. And you could read the rest of the list. Empathy can lead to personal distress, or it can lead to compassionate action. Caring for others can also involve neglecting oneself and one's family. So I'm a great believer in taking quiet time every day. I started doing meditation when I was 16. So that means that for nearly 50 years, I've done some kind of contemplative practice every morning. I'm not suggesting this is something that everyone needs to do, but I'm wondering if you could consider taking 2 minutes out of your day, maybe 2 minutes in the morning and 2 minutes in the evening, to do nothing other than be aware of your own thoughts, your own feelings, and your own body. In no more structured way than that, just taking those 2 minutes and saying, what's going on in this internal world inside me? And how might this be influencing how I view the world? Okay, what's the feeling tone that underlies these thoughts and feelings and sensations? Am I seeing the world through a glass half empty? Am I seeing the world through rose-colored glasses or through a gray, misty shroud? And just see what happens with that awareness. Nothing more than that, just being aware of the state of your mental being. Finding opportunities to stop during the workday. So you're about to go into a patient's room, you touch the doorknob, you stop, take a breath, observe yourself and your surroundings. Focus your attention on what's most important right in this moment as you're about to enter the room to see a patient, and then proceed. And try doing this with every patient, let's say for a week, and see what happens. This is something that I've kind of done habitually for quite a while. And if you do this with every patient for a week, and let's say you have 20 patients a day, maybe that's a lot or little, whatever. And so that's 100 patients a week. And at the end of a year, you've done this several thousand times. And anything that you do a few thousand times, you begin to get good at. In medicine, we ask a lot of questions, but those questions are often ones that have concrete answers. And what I suggest is think about questions that only you can answer by looking inside yourself, or only your student can answer. So on rounds, I might ask a student, what are you assuming that might not be true? Which means that you have to be aware of your assumptions and the lens through which you view the world. You can also ask that for yourself and see what that does to your diagnostic acumen. Can you see the same situation with new eyes? What would a trusted peer say? What surprised you? What was unexpected? What do you notice about yourself when you're at your best? Is there some way that you can invoke that? Mindfulness in some way is about listening. It's listening to your interior life and also listening to others. And so this is one quality of deep listening. Let's say when you really want to understand someone else, not necessarily respond, but understand. So you'd want to spend most of your time listening, be curious, ask questions that aim to deepen understanding, and be aware of jumping too quickly into making interpretations, giving advice, or even talking about yourself, and see how that might play out. When I was really down in the dumps about the electronic health record, a patient of mine actually said to me, you used to be a really good listener, but ever since you got this new computer system, you're looking at the screen all the time. And this is someone I knew well, and I knew he liked me and was really saying this as a caring gesture. And that just was like a dagger through my heart, because I teach communication skills. I value my ability to communicate with patients. And here I was feeling like a total failure. So I decided to spend the first 90 seconds of every office visit just listening and just asking questions to clarify, but not giving advice, not making interpretations, not turning the computer on, not talking about myself. I found two things. One is that patients didn't need to repeat themselves. I didn't have to ask them to repeat anything because I took it in. Patients seemed to be more engaged. Actually, three things. And the third thing is that I didn't finish the day any later. That is that I really was able to be just as efficient and felt more satisfied at the end of the day. Felt like I was doing the work that I was really made to do, born to do. Other aspects of being mindful in dialogue, sharing stories, and in workshops, we tend to have people share stories about meaningful experiences, distressing experiences, errors, bad outcomes, conflicts, etc. And also to take an appreciative approach in which you can see in those difficult moments times at which you were able to respond using all of your inner resources when you were at your best. So not only entering this kind of problem-solving mode, but also a mode in which you can appreciate the values, virtues, skills, and abilities that you have that can contribute towards future successes. And then finally, committing to change, considering and starting small, okay? Something that you're realistically able to do with little effort. Maybe like having lunch once a week without being connected to a device. And consider how you'll remind yourself. And you might even want to do that as part of this conference, just one small thing, and start even smaller. So if you think you're going to do something 3 times a week, start out by doing it once a week and see what that does for you. So we're just about out of time. I just want to summarize things that you can do right now. Stop turning towards dissonance, curiosity rather than avoidance. Positive focus, seeking curiosity, deep listening. Practicing presence, anything that helps you be in this moment, undistracted and clear. Be aware of your own personal warning signs of stress. Be aware of your community, who's in your bubble, who's outside your bubble, and who can actually reinforce and nourish your ability to be mindful. And finally, committing to change, changing yourself, your habits, your team, your community, and your organization. So I want to thank the organizing committee and particularly Benzie Kluger, who was the person who invited me to be part of this really amazing conference and this great group of people, some of whom we have here in Rochester and others of whom I wish I could meet in person if this weren't virtual, but we'll do the best we can with this format, and looking forward to any questions and discussions you might have.